a lot of single parent. Is it one of
It
the
would be
reasons?
unfair for me at this point to speculate. Right now, the data collection is very active. And as per the data that has been collected, it is premarital sex which is likely one of the biggest causes for the spread of HIV-AIDS. Premarital would take us to sexually active ages of 15 to about 25. So, as of now, this is the data that stands before us. It has nothing to do with single motherhood or double or proper families. And of course, multiple sexual partners. So even if somebody is married, there is an indication in the data that there is a multiple partnership community habit. It seems to be one of the biggest indicator. But all of this data can only be consolidated once we have testing across the board. Because right now we don't even have testing across the board. It's only when one has to go for a delivery of a child that one is tested compulsorily. One has to go for a surgery that one is tested compulsorily. One who's donating blood or getting blood transfusion, who is compulsorily getting tested, or very serious ailments of citizens, tuberculosis, Hep C, and all of these other diseases. So it still doesn't cover the larger population. This is still a population in isolation, likely not even covering 30 to 40% of your population. So if you have to know what exactly is going on, then we need to sit and look at the legalities of whether or not we can have other methods of testing also.
Ma'am, how many MLAs total attended?
So there were just 8 of us in the entire district that attended this meeting. And we will try again. We will continue to try. Officers from MAX have been trying to knock at the doors of MLAs, but MLAs are not receptive. So we don't know whether or not it is because they were too busy or whether or not there are other factors, but DCM himself from his office has requested every MLA in the district to come. But maybe they got a little preoccupied, though we had given notice well in advance. But it's okay, we'll try again. But it is a concern.
Coming to Meghalaya AIDS Control Society, crores of rupees have come and gone. We don't know where it has gone because the alarming number of cases are there. And we have only seen holding musical concerts. So any auditing has been done?
Yes. See, we have the guidelines. We follow the guidelines given by the National AIDS Control Organization, and every year we do submit the utilization certificate.
But it is increasing.
The fund
Cases are increasing.
The
Money is
cases-
also increasing.
No, so can I intervene,
Yeah,
please? It is incorrect to presume that there's crores of rupees coming and we are not doing a good job. Now, if you want us to share the interventions of the Meghalaya AIDS Control Society, or MAX as we call it, we can share that information with you, but we should not presume that work is not getting done. Now, why was it that the MAX was using popular, youthful interactions like football, music concerts, festivals of the young people or youth festivals? Because this is where the awareness needs to begin, because it is indicative of the practice and data information that we are receiving. So that is why we now also are on that page where we said you have engaged in awareness from 2006 to 2025. Now it's time to break that utilization of fund into more result-oriented interventions. We are at that page right now. But if you do have any doubts about that, then we can have a separate, you can have a separate sharing of your data with them. Because NACO is a very reputed government agency. Funding will not be sanctioned if utilization of funds is not submitted properly.
You are admitting anyway that 19 years is a long period that we could not
We
achieve.
have admitted. And so we are now at that stage where MLAs are also taking responsibility. At one point of time, it was unheard of. We were depending on faith-based organization or church organization or faith organizations. We were depending on established NGOs. But now we know that result needs to be reviewed, and we're reviewing that result now.
Do you feel the COVID mode reporting and treatment cases should be done?
So we discussed in the MLAs forum just now in the leadership of the DCM that even if government has to take a pandemic-like approach, it shall be done.
Ma'am, when